Now, a number of things happened last year, especially in the health sector. The transition to SHA is seemingly coming with its own shortcomings, including what the clinical officers term as discrimination in as far as their practice is concerned. I'm engaging George Gibore, who is the General Secretary of KUKO, but I'm also here with Mary Boniface, who is the National Treasurer. In fact, Mary, thank you so much. You've been giving me a bit of tips on how to handle a cold. And then I also want to look at, when you talk about the conversion, and I'm just going to read that directly, of all short-term contractual employment for clinical officers into the permanent and pensionable terms. This is something a lot of Kenyans would anticipate that is already done, because it's not a conversation we're hearing for the first time. The president has spoken to this matter, so has a number of voices of reason spoken on the matter as well. First, why is it so important that this review is done and this conversion is done? And then perhaps if you have information on how far it has gone, you could also bring us up to speed on that particular demand or implementation progress.
The conversion of the contracts, yes. I call them contracted officers to permanent and pensionable, was one of our demands in our strike in last year. And we have clinical officers who are employed under what we call the U8C, which is the
yes.
Universal Health Coverage contract. But then we also have other contracts that usually are done by particular counties and facilities within counties to cover gaps and to take care of emergencies and such things. And these contracts, we usually say they are quite unfair, because the terms they give the officers are not the terms who their colleagues in permanent and pensionable are enjoying, and they do the same work. So the motion of same work, or rather equal pay for equal work done, does not apply. And we are saying that they are demeaning, because if we do the same work, we cover the same hours, we go through the same risk, then we should be paid the same amount. But this has not been the case. And the universal health coverage contracts have been renewed now for their second term. That is, these officers worked the first 3 years, they completed, and then it was renewed again.
These same contracts that you want changed?
The same contracts, okay, with the same terms. It was renewed again, and actually I believe now they are looking towards the end of these contracts. And we keep saying that once these contracts end, then these officers should be converted immediately to permanent and pensionable, because one, these officers were employed during COVID. They helped the country tackle the menace that was COVID, and therefore they are key. They should actually be looked at heroes, because they came in when the country really needed them. And also, as it is, our healthcare workers shortage is a menace in this country, and Kenyans suffer a lot because of this, because in most facilities you find that where you expect a certain number of officers, that is not the case. And I believe the WHO ratios they recommended, and we are way far from that. And this turning these officers to permanent will help a lot, because as it is, even that short period when their contracts expired and they were not working, the impact of them being away was being felt, because they are contributing to the number of workers, and the moment you have them taken away, then there is a gap, or rather the gap actually widens. So we need these people to be converted, because they will add to the numbers of healthcare workers that are available to provide services to Kenyans. And two is that it is unfair, very unfair, for them to be working under different terms while they are doing the same work their counterparts are doing.
I really want to hear, but before I hear from George Gibore, you said that there is a shortage of healthcare workers, when essentially we're even then exporting or planning to export this particular labor to other countries? I mean, in hundreds. Are you talking about us not absorbing what we have, or we don't have qualified healthcare workers? When you say shortage, what do you mean shortage?
The shortage is there because, the notion that we are importing because we have enough is not true. It is very, very untrue, and people should not look at it that way. Our production of healthcare workers, I would say it's quite good. The training institutions, we have literally all cadres training and being available, but we have huge numbers of them unemployed.
All right.
For example, I tell you, currently, we have about 30,000 clinic officers, and we only have about 7,000 working in the public service, and a few others working with the NGOs and in the private sector. So that is to say, we have more than 15,000 clinic officers who are unemployed. And if you look across the cadres, the nurses, the lab, the nutritionists, the case is the same. And they are not absorbing because most counties will keep talking about the wage. They would say they have hit their ceiling, they cannot employ more. But again, if you look at what is happening in terms of service delivery, burnout is real. People are being overworked in the facilities, and especially at the rural areas, you find that a facility can only have one officer or two, while it's supposed to have about 6 or 8. And what that means is that this particular officer will be, one, overworked, and two, what happens when, for example, they fall sick, the facility is closed or it is opened by other officers who cannot offer treatment for just them to sit there and turn away patients. So the situation at the facilities is quite wanting. The shortage is dire, and I know majority Kenyans can attest this, that they have to wait. They waste a lot of time in the hospitals waiting because probably there is one clinician, there is one medical officer. So shortage is an issue, a major one in this country.
Very interesting. I want us to just, in hindsight, look at some of the happenings last year. But on this one, we're going to be bringing in the officials from the Kenya Medical Practitioners, I think Dentist Union, Davji Atala, and I would hear from George Gibora then, if in one voice, because it's a time then that we had medical officers support the others, say if they are on the streets, we will as well join them. But if things are working for other unions, if they are, would it then work for the clinical officers? But in what magnitude? Let's just look at this in hindsight, 2024, happenings in the health sector.
We are declared, based on our union's resolution in the Special Delegate Conference, that we are not going to take any more promises in this particular strike notice that we issued. We want to appreciate the involvement of the Deputy President, the Council of Governors, and the Ministry of Health that have worked around the time to ensure that what we demanded, that is the evidence that the doctors in the counties are receiving the basic salary arrears, for us to sit here today.
We are glad that we can now sigh with relief that our hospitals, our public hospitals, will be operating because our doctors are going to continue providing health services, which is their calling. I want to reiterate the commitment of the government of Kenya.
Let's hear from Gibora at this point in time. You've seen there the Deputy President, Kithure Kindiki, in support of the medical fraternity. Of course, I don't see you there, George, but talking about the government's best interests, the people's best interests at the heart of the government. What is it then? Have you reached out to maybe the office of the Deputy President? I know there was a memorandum to the President, but what we have seen there is the government's commitment ensuring that your demands, similarly to what was seen at KMPDU, are, taken care of. We cannot hear you. Daktari, if you're able to unmute yourself for us.
Sorry.
Thank you.
I hope you can hear me now.
We can hear you.
Thank you. I think in what you have shown to Kenyans and what the Deputy President did is a rare occasion and a rare incident where the Deputy President of a country had to intervene and address an issue which was going to cause the country in terms of pushing the health, the medical officers then to go on strike. We expected and then that position can be the same, where we see government officers being proactive to address the issues, because that is the reason why they are in office. Now, unfortunately, it also put the Minister of Health, or rather put it in a very precarious situation, because then it demonstrated that they lack priority or they do not understand priorities of Kenyan and the healthcare workers who they depend on to offer services. Because the issues that we are talking about are historical, and there is no way it can continue being repeated. And every time a new minister comes into that ministry, pronounce themselves very positively, after a few days they are swindled, or rather they are taken captive by the cartels in the Ministry of Health, to the extent that they cannot make a decision, even despite that the law favors the decision that even healthcare workers are agitating against. And that is why we say this is the Ministry of Health which has gone on strike together with the Social Health Authority by denying Kenyan health services by virtue of handicapping the healthcare workers who are the clinical officer in this aspect to not to give services. And also by allowing, or rather institutionalizing corruption, because some of the issues are pointed out are a pure corruption which ought to be fought by anyone. And that is why we say that because the ministry has gone on strike, and we feel that it is not wrong for us who have been denied the right to see patient to actually walk out of those facilities where we are not getting our right despite the law that support us. If you are to break down the issues that we are talking about, we see a ministry and council of governors who don't care, who probably they always promise heaven but do nothing in terms of priorities of Kenyans, only to react when there is a crisis. Now, what we are facing currently and what is going to happen in the near future, even when they don't address our issue and we go on strike, I can give a good example currently. There is a strike going on in Vihiga, which started on 26, I think a day before the Christmas, by the clinical officer. All the facility in Vihiga have been closed down and none is operating. So that's to mean then patients from those specific county, are depending on other counties. Unfortunately, these issues that we are talking about here is not only affecting the public sector, it is affecting the private sector as well. It is affecting faith-based facilities that are depending on clinical officers. And that is why we feel that the Ministry of Health does not mean well for Kenyan. And to the extent it is pushing, or rather pushing the cost of health service delivery higher. Because for instance, if I have to pay someone to use their personal number for me to offer services, that cost of paying that person, I must push it to the patient. Because there's no way I want to take a cost at the expenses of offering services. And my call to the president is that he knows this issue and he must respond as the CEO and the highest public officer who has been entrusted by Kenya to ensure that they can implement the constitution and all act of parliament that can guarantee services to them. If that is not the case, then I feel that this is a time that every Kenyan need to be very angry, because even the Social Health Authority has proven that it is not working. You have written laws, but whichever is being implemented can only tell you that the people who are doing it in a reverse way. Let me give a good example. That last week on Monday, I went to a facility seeking services for my child, and I'm a civil servant who knows my right. The facility said that they are not offering services to me because they have no contract with the Social Health Authority. I moved to the second facility, the same. On Friday, I got one of the facility to give me services without mentioning. I followed through the whole process until since morning until noon, actually past noon, minutes past noon. The system for Social Health Authority went down as I was being billed. So the services did not end, and up to date, I did not get the services. It is close to 2 weeks. That is the kind of situation that Kenyans are going through, and where I feel that the Social Health Authority and the Ministry of Health need to put more energy to ensure that every Kenyan, every single Kenyan who wants services can get it. Instead of going to parade one cases at Kenyatta or any other facility and try to tell us how SHA is working, they ought to think of cases that are not highlighted, where people are losing life. Thank you.
Very interesting, the experience that George is sharing. I do not know if you're watching back at home, and I can see a number of you still on YouTube. What is your experience with SHA? And if you're a clinical officer as well, please do let us know if your representation here in studio and on the conversation does represent your voice. And in that, he's given us a bit of diversion into what SHA is actually coming out as. And I don't know if you have anything to add on that. First, as a medical practitioner, and secondly, as a Kenyan.
I would say that just starting from, what we expect, and the spirit of the current government was in terms of what they gave us as a manifesto is to promote primary health care. And in this case, I would say primary health care is the driver to universal health coverage, which of course improves access to health care, but most importantly, what Kenyans are worried about takes care of the cost. And that means Kenyans can access health care without having to spend from their pockets, which is very important. But again, as healthcare workers, we're seeing that being derailed, and starting from what we are talking about as clinical officers, because when we limit, or rather we reduce the number of facilities that can be able to give healthcare, then again it's to derail, or rather it's to go against the very principle of universal health coverage. And we have seen, or rather we have also seen healthcare providers talking about not being sure on, how to go about the process, how to give the services. And most private facilities, and just like my colleague has said, that is one voice representing many other. And towards the end of the year, we had the organization the organization of private health facilities saying that they were going also to withdraw their services from, or rather they are not going to offer services to patients who are insured by SHA. And that tells you that there is a disconnect of, the entire process. And I feel like communication and advocacy is a big failure in the whole thing. And, the rushing to roll out without really, communicating what the procedures are, both to the providers and to the people. Because, for example, when you say, I can only get services from level 2 and level 3, and now when I need, further services, that now I get referred. What if I live in a place where the nearest facility to me is a level 4, and I walk there, and then they have to tell me, go back to the dispensary, and then the dispensary will now refer you to, a lot of issues, confusion in terms of people not knowing what exactly to do, what to expect. And it is true, because we have seen, even in the news channels, Kenyans saying what their experiences are. And especially that issue of the system is, is not working. The system is down. It's quite annoying, and we have actually seen patients go to the hospital in the morning, they go back in the evening without having gotten the service, meaning a day is wasted, and they have to come back again the following day to try again if they will get the service. So there is a challenge, and it needs to be addressed.
It needs to be addressed, and I'm looking forward to even a more deeper conversation with you somewhere in this year as we follow closely on how SHA is unfolding. But before we actually close, I want to hear from Gibore, and before I hear from Gibore, I want to play a bite of what transpired last year, because Kenyans would be asking, are we doing the same things, expecting different results? Is it that governance expects negotiations and timelines to meet certain demands? And if not, we go back to the drawing table? Or is there a way to come to a full conclusion of the issues at hand? Let's look at the, look back to last year.
To have a recognition agreement and a CBA within the next 48 hours. That's one side. If you don't get that, they will go close the hospital as we demand the board to resign.
When you have firstly decide kwamba hawa hawatafanya kazi, watapitia kwa mtu mwingine kinyume na sheria. Tunasema sababu yako ni kwa ajili ya kujibinafsisha na kuendelesha wizi wa mali ya umma kinyume na sheria.
Well, there you are. Let's hear from him. He's joining us live from Mombasa. And that was my question. Are we doing the same things, expecting different results? Because, of course, we've seen strikes in almost every administration in this country. But, of course, the one last year kind of prolonged to beat the record that has existed. What do you think is going to happen? Is it going to be any different this time, if in case the window lapses and you go back to the streets? You're muted, Dr. Riwi. We need to remind you to unmute yourself again,
Sorry.
sir.
Yes, thank you very much. And
Thank you.
let me say this, that we have laws that govern negotiations, and once you go on strike, the expectation is that you have to be on the table to negotiate. The issues that we have raised currently, we have already negotiated, and we only need implementation. We can expect that the Minister of Health and the county government moves with speed to address the issues that are obvious and that we have been engaging years in, years out without any answer. We want to see the goodwill of the government, but if not within the next 14 days, we want to declare that clinical officer exists and offer services from the highest level, that's the referral facilities, to the lowest facilities that exist in this country. We shall be going on strike, and we shall be seeking to enforce law and order and implementation of our previous agreement that the ministry continue to ignore. And as we do that, we want to announce to Kenya that we are not your enemy. And that is why we give a window period of 14 days for the government to respond on the issues that we are raising. None of the government officials have denied that the issues we are raising are legitimate, that we have an argument on how to be addressed, but they have chosen not to prioritize the issues that can guarantee service delivery to Kenya. In any case, they are pushing the costs high and, of course, subverting even the existing laws, making it worse in terms of the pathway to realize UHC. And therefore, it is also a clarion call to the president that you have men and women in the Ministry of Health who will never assist you to achieve the dream for UHC, which has been launched for more than 4 times, and no result, no tangible result is there. You managed to bring 4 laws in place, but these laws will just gather dust in the offices, and nothing will come out of this because we are the partakers of this. And once we have been discriminated, we are saying we will not participate in law breaking, we will actually stand against law breaking, and that is why this strike is obvious unless it has been addressed, our issues are addressed in full.
Thank you very much. Thank you so much, George Gibore, for joining us. What are your closing remarks, Mary? Just 30 seconds.
I would like to say that, we do not like it that we have to go to strike. Clinical officers are, before they are clinical officers, they are Kenyans, and they love doing their job, and we would not, be happy that we have to go on strike, and therefore we call upon the responsible people to ensure that they solve these issues before the 14 days elapse, so that we can ensure continuity of care to Kenyans. It's a bad time where we are talking about increasing burden of disease, and especially the non-communicable disease, hypertension, diabetes, the cancers, and therefore we do not, want to have officers away from their workplaces. So let them do the necessary and solve the issues before the 14 days are over. Otherwise, if that is not done, then on 19th midnight, we are out of the workplace.
But we need you in those facilities for sure. And thank you so much for creating time to be here to shed light on those demands, to explain to Kenyans what exactly the clinical officers in Kenya are demanding, including what has not been implemented that seemingly was agreed on last year. There has been a whole team behind this successful broadcast, and I want to appreciate you as well for being part of our viewership online and right here. Damian Evans has been on sign language. My name is Anki Doris Ombat. Remember, we do not stop at that. We follow up to the latter. Here is where facts inspire fun. Have a good night. Enjoy the rest of your viewing.